and thank you for coming to the 6th meeting of the Voices in Vegan Studies speaker series hosted by Arihanta Institute. I am Jonathan Dickstein, professor at Arihanta Institute and lead organizer of the Vegan Studies Initiative at Arihanta. So Arihanta Institute is a Jain Studies Institute at its core, and Jainism has promoted vegetarianism for over 2 millennia. Veganism has more recently appeared on Jainism's ethical radar, both inside and outside of India. And this is really why we have initiated this program at the Institute. Our initiative at Arihanta is multi-pronged, interweaving graduate level academic training, live and self-paced online courses, public conferences and guest speaker events, such as today's event, and global partnerships with aligned organizations. Overall, the mission is to educate, empower, and connect everyone, Jain and non-Jain, passionate about reimagining and co-creating a world in which our values and actions converge. Please go to our website, arihantainstitute.org, for more information on the Vegan Studies program and additional content and events. So as for this series, the Voices in Vegan Studies speaker series is spread out over 9 lectures until the end of 2024. After our talk today, the next one is on October 21st with Dr. Renan Leroux, who is presenting on the philosophical bases of veganism in the ancient Western world. And then look out for talks by Nirva Patel and Shailin Shah to close out the series in 2024. But now let's turn to today's speaker, Dr. Pritesh Mutha. Dr. Mutha is a triple board certified physician in internal medicine, gastroenterology, and lifestyle medicine with advanced training in interventional gastroenterology and endoscopy. He is an associate professor at UTHealth Houston in Texas and has published several peer-reviewed publications in esteemed medical journals. He is also the director of the Third Space Endoscopy program for the Center for Interventional Gastroenterology at UTHealth, a comprehensive program focusing on cutting-edge endoscopic management of gastrointestinal diseases. Beyond his clinical endeavors, he is a co-founder of the altruistic nonprofit organization Stress Academy, dedicated to empowering individuals in conquering stress from within. Dr. Mutha has been a passionate learner and lifelong practitioner of Jain philosophy. He has been imparting teachings of Jain philosophy to both children and adults for over a decade. I now turn it over to Dr. Mutha for Dairy-Free Jain Diet, a Health Perspective. Thank you so much for being here.
Thank you for having me here. Thank you, Dr. Dickstein and Arihanta Institute. Thank you for such a kind introduction. Without further ado, let's get started. So the topic, as was described earlier, is dairy-free Jain diet, a health perspective. And there will be plenty of time for Q&A at the end, but feel free to ask questions even throughout and answer the questions that I'm asking if you get a chance in the chat box or in Q&A session. The other thing is I'm on call, so I may have to step out for a couple of minutes if I get emergency calls from the hospital. So I apologize in advance for that. Hopefully we will not be disturbed, but just in case. All right. So let's start with a question, quick question. What causes majority of the diseases? More than 80%. So is it genetics or hereditary? Is it the germs? Is it the diet and lifestyle? Global warming? Or we don't know? I don't know if you have any answers on Q&A session.
And folks, you can drop answers to these questions in the Q&A box. that works. I will know that they are answers and not questions. So there's a diet and lifestyle. It's kind of been the dominant response here.
Okay, that's perfect. Actually, the topic is aligned to that. But majority of the people, when you ask around, who those who are not on this platform, they'll either say, "Oh, it runs in my family," or "It's the germs," and some might even say global warming. And majority of our textbooks actually say we don't know. So diet and lifestyle is actually the major part of our diseases. So as I said, all right. So what is the best diet to prevent, treat, or even reverse diseases? Atkins diet, Mediterranean diet, keto diet, Weight Watchers, something else, or no such thing exists, because we are talking about not just prevention, but treatment and reversal.
Again, feel free to use the Q&A feature to put your answers.
Any answers?
A Mediterranean diet is an answer.
Okay.
Still waiting for a few others.
Now we'll go with that. So the thing is, it's something else. Any type of discipline, you have to understand this. Any type of discipline you bring in your life, you're going to see some improvement. But truly, the long-term sustainable improvement for treatment and reversal is not Mediterranean diet. There are better diets that have proven to be better than Mediterranean diet in reversing. So, and we'll go over that today. So, but majority of our books say that there is no such diet actually to reverse the diseases. You have to take medicines. Unfortunately, that's the Western medicine right now. So I'll go over a quick case scenario. There was a patient who was pretty healthy in his late 30s, early 40s, IT professional, working really hard, and started having this chest pain. I went to the doctors, they did all kinds of tests. They found he has diabetes, blood pressure, and cholesterol. And of course, the recommendation was start a bunch of pills. They reached out to me. They were like, "Oh my, I've been prescribed 4 different medications. I've been asked to take it for the rest of my life. Is there any other option?" So the other option was lifestyle medicine. And I was like, let's try lifestyle medicine and see how it goes. And, within a matter of 6 to 8 weeks, patients, all of the diseases were reversed. Diabetes had gone, no blood pressure, no cholesterol, everything had normalized. It just took 8 weeks with lifestyle medicine. So we'll learn what is lifestyle medicine. And there was a case study at our university about this patient with gastric cancer, stomach cancer, that I removed endoscopically with advanced technique. But at the same time, I did a research article on this review article, and we found that gastric cancer was directly related to animal protein and salt. These two were big factors to related to gastric cancer. We'll not go over that video, but that was the summary. So let's understand what is lifestyle medicine. So there's an American College of Lifestyle Medicine that was founded about 20 years ago. And they have come up with this specialty. Lifestyle medicine is a medical specialty that uses therapeutic lifestyle interventions as a primary modality to treat chronic conditions, including but not limited to cardiovascular, that is heart disease, type 2 diabetes, obesity, and it also provides effective prevention for these conditions. Now, whenever you go to the doctor, generally what we've been taught is take these medications and in addition, just change your diet, eat more fruits and vegetables and that kind of diet. We never thought of treating primarily with diet and lifestyle and how powerful that is. And that was the concept being brought about in Western countries by this college, American College of Lifestyle Medicine. So I'm board certified in this, and now it is getting popularity. More doctors are understanding and recognizing this and trying to get trained in this. All right. So what is the Jain way of life? Let's understand. We talked about lifestyle medicine, your Jains, we're talking about Jain way of life. So Jainism as we learned today, was brought to us by Mahavir Swami Bhagwan, right? This was the 24th Tirthankar. He reestablished the order, reestablished the Sangh. He was the omniscient, Tirthankars, omniscient, right? Knew everything that has happened, that is happening, and that will happen in future, and provided the path to infinite happiness so that you can achieve the same state. And to achieve that, you need to have sound mental and physical health. So he provided us the path for that as well. So lifestyle medicine talks about 6 pillars of lifestyle medicine. There is one, nutrition, a whole foods plant-based diet. Um, then second is physical activity. Third is restorative sleep. Fourth is stress management. Fifth is avoidance of risky substances. And sixth is positive social connections volunteering. Now, there are 6 pillars. Today, our main focus is going to be on nutrition, which is probably the 80% of the whole thing. I mean, people can do a lot of exercise, a lot of activity, do lots of other stuff, but if your diet is not fixed, you're more likely going to be in trouble. You may improve some, but you're not going to get all the way. So our focus is mainly going to be on nutrition. I'll talk about the other stuff. I will touch a little bit on those other pillars as well. And then we're going to see the comparison between lifestyle medicine and Jainism, right? So first pillar, nutrition, healthy diet. So the recommendation is whole foods plant-based diet, or we can call it whole foods vegan diet, because there could be bad vegan diet, or there could be whole foods plant-based diet and people will add some animal products to it. So this is 100% plant-based, that is vegan, but it should be whole foods vegan diet. These are the foods rich in fiber, which is extremely important for healthy gut microbiome. That is bacteria in your gut, which are very helpful if you feed the right stuff to them. And they can be dangerous if you feed the bad stuff to them. So what does it consist of? Fruits, grains, legumes, vegetables, plus nuts and seeds. So this is the major component of your diet, and there could be herbs and spices that you can add on. Your microbiome, the bacteria in your gut, there are about 100 trillion bacteria in your large bowel, which are very important. They thrive on fiber. The goal of fiber consumption should be more than 40 grams per day. The Western medicine says about 30 grams for female, 40 grams for male. But historically speaking, what we've noticed is more than 80 to 100 grams per day will truly make you healthy and keep you away from all kinds of illnesses. So it should be whole foods and not through supplements. Don't take fiber supplements. That doesn't do the job that you need. You need to eat fiber in its original form. So how does Jainism connect to it? So the whole foods plant-based diet says that there should be no animal products and no processed foods, like zero animal products, no dairy, no yogurt, no buttermilk, no cheese, none of that stuff, no eggs, no honey. And it should not have any chemicals, preservatives, emulsifiers, coloring agents, any kind of that stuff. Anytime you have those agents, so you can have vegan foods, which have all kinds of these preservatives, not good for you. So you don't want any animal products and you don't want any preservatives. So let's talk about Jainism and whole foods plant-based diet. So this is something called as Mahavigai. And I'll go over what is Mahavigai in a minute. Mahavigai consists of honey, alcohol, eggs and meat, and butter. That's absolutely not allowed in any condition in Jainism. And then there is Vigai, which has milk, yogurt, ghee, that is butter, not exactly butter, but ghee that is made out of butter. Then there is oil, there is jaggery, and there is sugar. So there are 4 of these, and you can put 5 or sugar and jaggery together and 5 of Vigai. So 4 Mahavigai and 5 Vigai, which are not good for you per Jainism. And let's understand what it means and why is it not good for you. So the term Vigai, Mahavigai means just greater, but much worse than Vigai. So the term Vigai means Vigati. That means lesser form of life, as in there are 4 gatis, 4 different states that our soul can be born as. These can be born, our soul can be born as human, celestial beings, hellish beings, or tiryansh, that is animal or planets. And vigati means bad gati, that you're not going in a place where you can actually advance your progress to achieve moksha or achieve the eternal, infinite happiness, liberation. And so you end up with being a tiryansh, that animal plant, versus hellish being by vigati. Vigati means that kind of. And the other meaning for the same word, vigai, means vikruti. What does it mean? It means distorted or sensual thoughts and passions, heightened stimulation of senses. As you know, you're learning Jainism. In Jainism, our goal is to go towards our own soul, to be in pure form, in peaceful form, and stay away from sensual pleasures to experience that infinite bliss within. And when you eat these kind of very calorie rich, calorie dense products, it causes vikruti, it causes heightened sensual pleasures, and more likely you will end up binding bad karmas, and the downward cycle continues. So vikruti can be at physical. Your body is also hurt by these kind of foods. Mental, your thoughts, you're more tired, fatigued, you can't focus, lazy, all of that. You don't feel lighter, don't feel energetic. And spiritual level, you can't do proper spiritual practices when your thoughts you have those kind of passions and thoughts in your mind. Passions are nothing but kashayas, by the way, and kashayas are what keep us in this cycle of birth and death. Kashayas are anger, ego, deceit, and greed. So vigai means that causes bad gati, or causes bad kinds of thoughts which hurt your body, mind, and spiritual level. So two citations. One is from Sthananga Sutra. According to Sthananga Sutra 9, one of the 12 angas from the agams, vigais are of 9 types: milk, curd, butter, ghee, oil, jaggery, honey, wine, that is alcohol, and meat. So nava vigayo pannattao tam jaha khiram dadhim navarniyam sappim telam gulam mahu majjam masam. It talks about the 9, literally the same things that we read, the 9 types of vigai. So this is not good for you, was mentioned in Thanang Sutra, Sthanang Sutra. The other mention of this comes about in Pachakan Bhashya, 48th Sutra, in that Pachakan Bhashya Grantha, or book, Jain book, written centuries ago. It says that whenever we eat vigai, it increases our sensual thoughts and passions, that is vikruti, which ultimately leads us to lesser form of life, or bad gati. So from mental and spiritual standpoint, so vigai bhyo, vigai gayam jo u bhunjaye sahu, vigai sahava, vigaim balanei. So it will forcefully take you to the bad outcomes. That's literally what it means. So this is the citation in our grants about vigai, where it talks about all the dairy products, all the animal products, all the alcoholic or addictive substances, even honey in there. Now let's learn a little more about current science, why dairy is harmful for us. It is naturally produced by lactating mothers. No mother will produce milk without these hormones. So cows, buffaloes, I mean, humans are no exception. So cows, buffaloes, goats, etc. And this milk that is produced, that is good for the baby that it was produced for. But these hormones, when we were drinking our mother's milk, our body was aligned to that. When we weaned off of it, we should not be drinking some other species mother's milk, because those hormones are not good for us. They're not aligned with our body's natural cycle. Plus, there's mistreatment of mothers and cows. So all the cattle, cows and buffaloes, goats, they're not treated properly. Their calves are not treated properly. They go to slaughterhouse. They're taken away from their mothers. So mother's always stressed. She's not happy. Now there's cortisol, there's adrenaline, there's epinephrine, norepinephrine. All kinds of hormones are released in her body, and that goes into the milk that you consume, and that's going to hurt you in short and long run, and end up causing all kinds of diseases. The the farmers give hormones to cows and buffaloes for their growth, for increased milk production. So you'll get oxytocin, growth hormones, and even for their growth, they put sex hormones in there so they can grow faster and rapidly and become bigger. Or eventually they want them for meat as well. So these are not good for you. This increases risk of all sorts of serious and deadly diseases, even minor diseases that destroys your quality of life. I see a ton of patients who are hurting with severe or hurting all the time. There's severe pain, and all kinds of tests have we done. We have done scans, endoscopy, all sorts of stuff. Everything comes back negative. The moment I change their diet to whole foods, plant-based diet, they actually follow through on that. The pain that they were struggling for years starts disappearing pretty quickly because these hormones go and trigger certain receptors called estrogen receptors on your gut, which increase your pain receptor, pain levels, and multiple other factors that trigger it will affect your menses and all sorts of top to bottom, all of your systems, bodily systems are affected by these hormones. In shorter form, in longer form, you're looking at serious and deadly diseases, including cancer, gastrointestinal problems, menstrual problems, risk of obesity, type 2 diabetes, and so on and so forth. There's some thought that it might be even one of the triggers for type 1 diabetes, but there are some theories. I'm not going to talk about that for now. So dairy is harmful. Why? Antibiotic resistance. Believe it or not, 70% of all the antibiotics that are consumed in America is actually consumed by cattle. These 70% of antibiotics are given to all kinds of cows and buffaloes, and 30% of the antibiotics are used by rest, including humans. So the major cause of resistance, and we are always taught, doctors are always taught, use antibiotics sparingly because we're seeing so many deadly resistant bacteria that we cannot treat with the antibiotics. Well, the bigger problem is majority of these antibiotics are going to the animals, and these antibiotics come through the milk into your body, and now your bacteria are getting used to it, getting resistant, and when you have infection, it's much more deadly, much more severe. The other thing is dairy has saturated fat. Believe it or not, the fat in the calories in milk from fat content is close to 50%. Well, 2% milk should have only 2% calories, right? No, even 2% milk has 40% fat in it, and majority of it is saturated fat. So there are different kinds of fat. Saturated fat is the worst. It increases the risk of stroke, heart disease, other chronic illnesses. So all along you thought, oh, you're eating it for more protein, you're consuming it for more protein. Well, you're getting more fat for sure. Cheese has 70% fat calories. So by no means think that cheese has protein. It actually has all the concentrated hormones, ton of fat, and it's hurting you in multiple different ways. It causes diabetes, obesity, Alzheimer's disease. Now, there's another chemical called trimethylamine nitrous oxide, TMAO. It actually is produced by your gut by digestion of eggs and milk products. It doubles the risk of heart disease, kidney disease, cancer, all of that stuff. The chief of American College of Cardiology, the president, he's no more president anymore. He was a president. He was like, this reason itself that the milk products are going to cause TMAO in your gut is the reason itself reason enough to stop consuming dairy. And Indians are much more vulnerable to heart disease than other people. So we are already vulnerable, and we have so much consumption of dairy. So we are just setting time bomb to end up with heart disease in near future. Allergies and inflammation. Majority of the allergies across the world are related to dairy. They contain proteins called arachidonic acids, which trigger allergies and inflammation. My personal example, I suffered for 30 years. My 90% of problem resolved when I went on completely whole foods plant-based diet. I went through all my medical school without learning about this. I had to graduate and learn it myself and then experiment. And that's when I recognized that all the drugs that I was putting in my body to treat the allergies was just Band-Aid treatment. The true cause was my diet. I fixed it, and 90% of it's not 100% gone, but 90% better for somebody who struggled for 3 decades of my life. So whole foods plant-based diet, how should it be? It should be farm. If it goes to factory for some processing, then it's something you should not consume completely out. If it goes from farm to factory to table, not a good pathway. But if it goes from farm to table directly, so in the farm, I'm thinking just plants. I'm not thinking animals. So when it grows on plants and directly comes to your table, that's the food you should eat. All right, what is the most common nutrient deficiency in Western world? Let's see who all can answer. What's the most common nutrient deficiency? Is it protein deficiency? A lot of people consume protein supplements. Is it B12 deficiency? Is it vitamin D deficiency? Or is it fiber deficiency?
Okay, Bronth, another question. You can answer this in the Q&A chat. What do you think? What is the most common nutrient deficiency in the Western world? Quickly, two came in and said fiber, another for fiber.
Great, excellent. All right, it is true. Actually, less than 3% of America consumes the daily minimum requirement of fiber. Minimum requirement, less than 3%. It's the most important nutrient probably, and we consume less than 3% of the 3% of people consume it less. So expectation should be more than 30 to 40 grams. That's the minimum. Ideally, it should be 80 to 100 grams or even more, and we're consuming not even 30 grams. So that's something we really need to fix to really become healthy. So the goal should be more than 40, ideally 80 to 100 grams. So less than 5%, but some estimates say less than 3%. There's no fiber in any animal products. Any animal products will have zero fiber. Always remember that. Refined and processed foods, they extract fiber out. So sugar, oil, packaged foods, artificial flavors, emulsifiers, coloring agents, preservatives, that's all you see, but no fiber. The other thing that I want you to remember is, fiber supplements, when you take that, it also has chemicals and preservatives in it, and some of them can cause cancer even. And data has clearly shown fiber supplements don't give you the same results as actually whole foods. So don't go by, oh, I'm just going to eat whatever I want to, and I'm going to take fiber supplement. That's not the answer. You got to eat the whole foods. All right. So what does Jainism talk about? So we talk about Vigay, but in addition, Jainism talks about intermittent fasting. So which is very popular. Lifestyle medicine recommendations are do intermittent fasting. In Jain principles, we talk about different kinds of austerities and tapasya. There's anshan, means upvas, means not eating for more than 36 hours, and there are different other small intermittent fasting options like karshi porshi. We fast for 13 hours, 14 hours, or 15, 16, or 18 hours. Those are options that have been written in Jainism and Agams thousands of years ago. Then Jainism, then lifestyle medicine also clearly says avoid eating late in the evening, preferably eat before sundown. That's what Jainism says. Ratri bhojan tyag, do not eat after sunset. Eat less frequently, very, very important. There's plenty of data published on that. You eat more frequently, you end up being sicker. So there are options. There's like you eat just one meal a day or two meal a day in Jainism, and you should eat within 48 minutes. And data has shown that if you eat for more than 50 to 55 minutes, there's another surge of insulin hormone, which is another weight gain hormone, and eventually leads to lots of diseases. So Jainism already mentioned that when you sit for a meal, finish within 48 minutes, 50 minutes, no more than that. Otherwise, you're going to end up with problems. So another thing that Jainism recommends is eat less than your appetite. And this has shown a ton of data in published literature that if you eat 60 to 80% of your appetite, you live much longer, you're much more healthier. And in Jainism, they talk about the second tap, unodari, means eating less than needed for satisfying your hunger or appetite. Then they also talk about vritti sankshep, that means curtailing your desires by limiting the number of foods you consume at one time. And then they recommend eating whole foods, plant-based diet by doing rasa tyag. That is number 4 tab that we talk about. Rasa tyag means giving up mahavigais and vigais that we went in a little bit detail. There's something called as ayambil tapasya that recommends that in Jainism. So there's 12 taps in Jainism, 6 bhayantar, that is external, 6 internal. In the 6 external taps, they talk about first tap is anshan, second is unodari, third is vritti sanship, and fourth is rasatyag, which talks about all the dietary recommendations that I just went over in detail. Now, that was the major part of the topic. We're going to just touch base on other pillars and how they were mentioned in our tapas, in 12 taps, and actually help to helped us understand how to live life happily. So lifestyle medicine was given to us by Maharaj Swami Bhagwan 2,500 years ago. We just didn't really appreciate, adapt as well. And fortunately, lifestyle medicine came up with all these published data, and we could actually show that how important it was that was recommended to us. So Jainism recommends sunbathing, doing cardio. I mean, of course, West lifestyle medicine recommends that cardio, stretching, and resistance training. So they talk about all of that. All these components are equally important. You have to do some sunbathing, you have to do cardio, you have to do stretching, you do and resistance training. So if you're not doing any exercise is better than none to start with. Okay, stay active, avoid sedentary lifestyle. Smoking, the new smoking is sitting. So sitting is new smoking. All right. So what does Jainism recommend? Fifth tapa is kaya klesh. Kaya klesh means putting your body through difficult circumstances. So why is that important? Well, Jainism recommends learning the importance of tolerance. So you can tolerate, the hunger part, but when you face difficulties in your life, physical, mental difficulties, when your body is strong, you can handle it and still maintain your equanimity. You maintain your calm. That can only happen if your body is strong enough to handle that. And that's why the fifth step was kaya klish, which is nothing but exercise, doing yoga, and a lot of different kinds of exercises to get stronger. And there are Jain stories are filled with these amazing heroes who were so powerful and were able to endure lots of difficulties to achieve liberation and moksha. And our sadhus, they walk, our monks, they walk miles and miles on a daily basis. They don't use any vehicles, and they go through all kinds of difficulties in their life to make sure their body gets stronger and they can handle and endure these difficult situations. Very, very important. So Jainism recommends the same thing. Then restorative sleep. Sleep is very important. Don't mess with your sleep. Don't sleep late. Don't be on screen all along. Don't be exposed to white light. Get your proper sleep at proper time. That's very important. And when you eat right, your sleep is going to be much better. Sleep is when your body starts healing, does power wash internally of your brain and of your body. So adequate restorative sleep has tremendous power to heal your body and power wash your brain of all the unwanted bad memories. It deletes all the bad memories and consolidates good memories as long as you follow good sleep hygiene and get good sleep. So avoid screen time and exposure to blue light for 1 to 2 hours prior to sleeping. Wind down hour by meditating or relaxing music. Proper exposure to sunlight in the daytime, it resets your biological clock, so your body knows at nighttime that you're ready for sleep, and body's going to start healing your body in sleep at night. So Jainism recommends that fixed sleep times for Jain monks, that is the middle part of the night. Not the first 3 hours and last 3 hours of the night, but middle 6 hours of the night are recommended for Jain monks to make sure you are asleep at that time. There's a book called Kalyan Karakam, which is a Jain Ayurvedic book written by Acharya Ugraditya in 9th century, recommends that secret of good health is adequate sleep. Poor sleeping habits can ruin your overall health. Our body needs optimum sleep. Too much or too little can be harmful. Sometimes your body may need longer sleep hours when you've exerted a lot, you're sick, so your body needs to rest. So be mindful of that. And always early to bed and early to rise. Fourth pillar of stress management. Lifestyle medicine is stress management. So we talk about mindfulness and meditation in stress management. In Jainism, we talk about how the stress occurs. In our nonprofit organization, Stress Academy, stressacademy.org, goes in details about this topic with multiple different videos explaining every single concept in detail with Jain citation and Western world research both together. So Jainism says that wrong knowledge plus wrong beliefs leads to uncontrolled emotions. There's a mithya gyan, mithya darshan, mithya charitra that leads to stress. So stress originates and is felt in the consciousness, not in the brain. We have free will, purusharth in Jainism, to manage stress through our knowledge, beliefs, and intentions. So There's a very nice meditation that we have. You can definitely go through it. Bhed Vigyan. It helps you identify who you are and who you are not, able to separate body from soul. And you can, Jainism talks about these tapas. Sixth tap is salinta, sitting in one position, not moving around. Prayashchit means repentance of all the bad deeds that I may have done. Vinay means humility. Then Swadhyay means reading religious scriptures and meditating over it. And then doing dhyan, that is again meditation. And kaya sarga, renouncing your body and going deep within the soul. So these are all the taps. All of these taps lead to state of infinite happiness. And in addition, there are 12 bhavanas to help you manage your stress. They're beautiful. There are lots of lectures in Jainism about this. There are several books written about it. These 12 bhavanas or 12 self reflections are the key to get out of any stressful situation in your life. They're the easiest way to de stress yourself. Now, fifth pillar, avoidance of risky substances. Jainism says that unless you avoid all kinds of 7 big addictions, we are not even kind of eligible to call ourselves a Jain. So no alcohol, no smoking, no drugs, none of that stuff. Completely, you must stay away from that. That's not good for your health, not for physical health, not for mental health, not for spiritual health. And that's what stress, lifestyle medicine also recommends: avoidance of risky substances. Jainism says avoid 7 mahavyasan, that is great addictions, which is meat. They call meat as addictive, alcohol and other drugs, gambling, hunting, extramarital, premarital affairs, prostitution, and stealing. These are 7 great addictions. We have to stay away from those. That's what Jainism says. That's what lifestyle medicine says. Avoid other addictions. Now, very important. Lots of Jains, many of us are addicted to tea, chai, and you're like, oh, if I don't have it, I start hurting, I have headache, all of those problems. So tea and coffee are neurostimulants, they are drugs, they're not food, and they're hurting your spiritual health and your physical health. So I recommend staying off of all these and actually change your coffee break, tea break to meditation break. All right, the sixth and last pillar of lifestyle medicine talks about positive social connections, volunteering. So when you have to stay connected with near and dear ones, loved ones. But the key is when you help others, you have to help without any expectations in return. If you are looking for name or fame or somebody thanking you or somebody being grateful to you or owing you something for in future, all of those expectations are going to make your volunteering not so helpful for you. Actually, it may hurt you, because if somebody does not follow through on your expectations, you're not going to be happy. It will release bad chemicals in your body. You will hurt. So anytime you help others, you volunteer, actually thank them for the opportunity to volunteer. They don't need to thank you. You should thank them that you got the opportunity to do that. Once you get that clearly in your mind and body, all of this will actually truly help you elevate and liberate yourself and not go down with all kinds of passions and ill thoughts and ill health. What does Jainism talk about it? Jainism says dan chapa ke nahi chipa ke dena chahiye. Now this is in Hindi. What it means is when you must donate, of course you must donate by, you can money, time, food, shelter, clothing, etc., but do it so anonymously and without any expectations in return. In Tattvar Sutra, one of the most important granth in Jainism that is accepted in all subsects, the 5th chapter of the book, in 21 shloka, we talk about parasparopagraha jivana, wherein it means that you're indebted to every soul in this world, and you should reciprocate by being kind, friendly, and helpful to everyone. So you're just paying off your debt. You're not helping someone truly because they should owe us something. You're helping because I owe it to them. It's my responsibility. Every soul has helped me so much indirectly or indirectly in this life or in past life. And I recognize that I'm going to help everybody because they've been so helpful to me. And this goes with 9th tap, Vyavacham, that is selfless service. So there's one other concept in India called nature cure, not just India, all over. And they talk about 5 elements of Ayurveda, where they talk about fasting, nutrition, water or hydrotherapy, sun therapy, pranayama and yoga. And that's the recipe for healing from all kinds of diseases. And the diet, of course, is whole foods, plant-based diet. Many times in India, it's called naturopathy, but not all the naturopathic doctors follow all the same principles. Nature cure is really more focused on healing your body by its natural methods, just providing the right fuel to the body. So lifestyle medicine and Jainism, 6 pillars of lifestyle medicine are the recipe to reverse diseases. The key is vigai tyag. That's the key, because diet is the most important. And in the diet, the key is to give up those vigais and mahavigais. So consume only whole foods, plant-based diet. 12 tapas in Jainism are similar to 6 pillars of lifestyle medicine. It's the age-old recipe by Jainism to prevent, treat, and reverse diseases. That will help you become mentally and physically healthy, will help you become medicine-free and disease-free. Of course, there is a small component of nikachit karma. You can't help that. But the rest of the karmas you can actually modify, you can change by your behaviors. And that's the medicine. Advance spiritually and achieve the state of infinite happiness by doing these 12 tapas. That is the recipe to destroy your karmas. And that's all I have. Thank you. I'll be happy to take any questions you may have.
Wonderful. Thank you, Dr. Mutha, so much for that just kind of exploration and journey through so many aspects of health and wellness and Jainism. And I think it's really helpful to both the Jains in the audience, non-Jains in the audience, really to get both sides. And at Arihanta, we're really trying to see where these Venn diagrams converge. So there's a few questions in our chat. I'm going to ask a question too. Would you mind, actually, I can't shut off the screen share. Would you mind dropping off the screen share for a minute?
Sure, for sure.
Great, wonderful. So I guess a question I have, and then I'll dive right into the questions in the Q&A, is if we see this, especially with Vigai and Jainism, Mahavigai and Vigai, then how do you at least think about, I'm not going to say why, but how do you juggle the presence of dairy in the Jain tradition, past and present, and what you have found in texts and elsewhere?
So that's the most common question that any Jain practitioner talks about dairy, avoiding dairy. That's the first question everybody says that, well, but it's been used for thousands of years. What happened all of a sudden? So they have to take it in context. Back in the day, there were, the cows were treated like family member. People used to have 10,000, in thousands actually, thousands and thousands of cows and buffaloes. They would make sure the calf is taken care of. The bullock was used, the bull was used for farming. And so everybody was well taken care of. They were treated like family member. The cow would get pregnant every 2 to 3 years. The calf was fed amply, properly fed. Everything was done. And there were so many cows. So what they used to do was a little bit left over, you put it all together, and they would have that little bit of it. When the cow is so happy, she's been taken care of like family member. The baby is so happy. The bull is so happy. Everybody was happy. So of course the stress hormones weren't there. The cow was not kept pregnant all the time. So the hormone levels were already lower. Right now what's happening is the cow is kept pregnant every year. Even when she's lactating, she's kept pregnant. So now your hormone levels naturally increase because there are pregnancy hormones and there's lactation hormones. All of those are going in your body. Plus, it's a business. They want to make money off of it. They can't afford to have all of these things. So all in all, it has become such a violent industry and nobody can afford to keep them for 20 whole years. So after she stops producing milk, they trend to slaughterhouse. They're like, no, we have these goshalas where we keep animals there when they are not able to produce. Well, you can only keep like 1.5 to 2 million of cows and buffaloes in these goshalas in entire India, but about 70 million are slaughtered every year. The numbers are staggering when we start looking at how bad it is. And then you look at how the practices are. I've visited the farms and I've seen how it goes. And you ask such probing questions and you realize, although it may look good, the back things are not as good as they seem. And so in today's day and age, I absolutely do not recommend dairy products for that reason.
Thank you. Yeah, I can see how that's this immediate question. Yeah, there is also this tension, as my colleague Yamini Narayanan has explored, that it's odd, especially in India, to say have policies that are against the slaughter of cows, but at the same time the promotion of a dairy industry. These things are logically incompatible, right? There are no
Exactly.
goshalas. It's just incompatible. But somehow, in an imaginary, we feel like they can be squared. But it doesn't take long to realize that
Exactly.
the cows have something has to be done with those cows when they are in their kind of post lactation stage, and it is certainly not economically viable. Maybe
Couple of
never
things.
ethically viable, but certainly not economically viable.
Couple of things that happens. Absolutely, that's true. Uh, that many times we are so addicted to these dairy products that when somebody says, oh, it's an agenda, it's a Western concept, all of that, then without looking into it, we want to hang on to those things because we've
Mm,
done it all our life. We think that's the right thing. Plus, I'm looking for some support to my decision. So, unless you're really open minded and looking into it, you will immediately find all the resources to understand how bad it is. And Jainism, the first rule is non-violence.
mm,
So you cannot be hurting any living being which is more than 2 cents being. So the fact that there are none of these practices are non-violent, that itself is the reason enough to give up per Jainism. From health perspective, all the reasons that I showed you and plenty more. Of course, within a short period of time, we can only cover so many. There's so much more we can talk about.
great. Thank you so much. And this seems aligned with Professor Christopher Miller asked the question similarly, like how has this been received in the Jain community, given that you're giving scriptural citations, medical science, and so on. But I think you just answered the question, is that the reflex is to go back to our families, our traditions, our habits, um, but maybe a little bit further down the line when we get sober with ourselves, in a sense, the data speaks for itself.
Absolutely. The other
Okay.
thing that happens is what I've noticed is many times people are on the fence, but once they go through some health problem, that's when they start looking into it. That oh, maybe it is not so good, and that's their leeway. That's their into leeway into that thought process that maybe it's not good for my health.
Hmm.
So I talk about that to them. Then they start seeing the results once they stop eating it. And then now they might be a little more open to actually look into the violent practices, why it's not so good. And then they probably give up dairy products. It doesn't happen all the time, but that's one of the ways that people also start
Hmm.
accepting it if they weren't or they were making fun of it in the beginning, maybe.
Yes, I mean, fortunately, unfortunately, we tend to be more open to things when they affect us directly or a family member, someone close to us.
Yeah.
Here's an interesting comment from someone who said, I once studied with an anatomy and nutrition specialist who said that the first thing he takes his patients off of is dairy, not meat. From a health perspective, and I think that's important that it's kind of from a health perspective, is dairy just as or even worse than meat? And so maybe this is a clinical question for you.
Um, so meat is known type 1 carcinogen.
Mhm.
So it has been accepted worldwide as a type 1 carcinogen. Processed carcinogen means cancer causing substance, processed meat. And unprocessed meat is type 2 carcinogen. So by no means you can touch meat and think that it's healthy. Some people will say, oh, I went on keto diet, I'm just carnivore diet, I'm feeling great. And a lot of people will feel that. I'll give you a short example. One of my friends who is a liver doctor who's pretty big and trying to lose weight, all his efforts were in vain because he just loved the food and he came across this keto diet and he suddenly lost a lot of weight. He felt great. He's like, okay, this is great. And like, whatever you say that works really, I'm like, you're a doctor, you know what happens in long run on this diet. He's like, I'm happy to die skinny. The point is, you know you're shortening your lifespan, and not just shortening your lifespan, you're going to end up with severe diseases very soon. You may see short-term benefits, but in long run, it's going to hurt you. So there is absolutely no reason to consume meat products. I mean, whoever recommends whatever you recommend, you go deep into it and you realize it's never a good thing to eat. Now, when you compare dairy and meat, now a very hard question, very tough question. Initially, I thought, okay, dairy products may not be as bad as meat, but what I've seen is lots and lots of Jains who follow Jain diet still end up with all kinds of cancer, colon cancer, which we know
Mm.
caused by red meat. But guess what? The protein in red meat and dairy products is exactly the same. So, uh, gastric cancer, you name it, gallbladder cancer. I've seen so many patients who were on strict Jain diet and still ended up with all kinds of these serious cancer. Forget about heart disease, diabetes, blood pressure. That's everybody. That's so sad. So, and the moment you stop all of this, you reverse. So I don't think that one is better than the other. They're both equally bad. Maybe there's, it's one might be lesser evil compared to the other, but eventually, in India, 35 marks, you need to get 35 marks to pass the exam. Beat 25 or beat 5, you fail on both the sides. So dairy and meat are, I think, on both, they're going to fail you on all aspects in short or long run. So there's no comparison that which one is better, so I can start consuming one.
Okay, that's good to know.
Yeah.
So here's a more general question. What practical advice would you give to healthcare professionals, yoga therapists, nutritionists who wish to incorporate spiritual and ethical teachings like those found in Jainism into patient care for better lifestyle management?
So, loaded question. It can be a very long answer. Definitely check out stressacademy.org to go over in details. But if I want to give you in one line, if you learn to not have expectations, when we say somebody must do this for me, or somebody must behave in certain way, that must is the cause of problem. If they do it, that's okay. If not, that's okay. The moment we are able to say that, you have relieved a huge burden off of yourself. And you, easier said and than done, but to achieve that mindset is to understand a little bit of karma theory, a little bit of
Mm.
concepts of Jainism, who you truly are, how they have been helpful to us, all of these people, even who is hurting us, some in some ways helping us. Once we understand those concepts, that's really going to help you advance. But if a simple statement, if I want to make, get your expectations, lowered, dial them down from must to might,
Hmm.
if that makes sense.
Yeah, I think that definitely helps out, and there seems to be a way in which you have to slowly drip that into the the kind of general healthcare management. How do we start to put those teachings in, especially when they might not resonate like with everybody, or certain aspects might resonate. Things like mindfulness, meditation, even if we took those out of a kind of a religious valence, they are going to provide benefits, um, regardless of how we frame them.
For sure.
So an interesting question here, I think that's a very Jain specific as well, about root vegetables, right? So root vegetables are abaksha, and you see this in the Jain lists, but they're not vigai, right?
Yeah,
So how would you talk about this? Or is there a difference between kind of the Jain perspective and the medical perspective once we get into this territory?
absolutely. There is no, just talking purely from Jain perspective. So in Jainism, there's always a level of hinsa, right? We know for survival, we cannot live off of, I mean, we have to eat a living being to survive, unfortunately. So then they have divided into one sensed to five sensed living beings. So ek indriya to five indriya. So Jainism says that anything more than two cents or above is absolute strict no. That's Mahavigay. That should not be touched upon. And currently, with the practices in dairy industry, I think dairy is falling into that category. Now, when you come to one sensed being, there's Pratyek Vanaspati and there's Sadharan Vanaspati, which means Pratyek Vanaspati means there's a kind of root vegetables where there are infinite number of lives within one vegetable. Whereas in other vegetables, there's one life form in one vegetable. So when you relatively speak, the goal is to minimize violence, right? Jainism recommends to you got to minimize violence as much as you can and keep advancing. So give up all the animal products. Then the next step is give up all the root vegetables, then go to just. So I personally do not consume either of those, root vegetables or dairy products. So that's what I recommend. But everybody has their own capacity. Unfortunately, in today's day and age, Jain diet has become synonymous with giving up root vegetables. People will end up eating at night. People will end up ton of dairy products. People will end up eating all the vigais, and they're like, I'm on strict Jain diet, and why am I getting sick? Well,
Mm.
Mahavir Swami Bhagavan was omniscient. He can never recommend he will never recommend diet that is actually unhealthy for you. So I think we have in some ways misinterpreted our diet. By the way, I kind of switched sadharan and pratyek vanaspati ka. Pratyek
Yeah.
means single, and sadharan means infinite living beings in one vegetable. So I just sorry about that. But the point is, you want to minimize your violence as we go forward. And so dairy products in today's day and age are much more violent. I'm not saying that give up dairy products, and if you're not eating root vegetables, start eating that. I'm just saying that understand that there's bigger. We are saving $5, but spending and incurring debt of $1 million, right? So you have to be mindful where we are making bigger violence. So you've got to start cutting down those first. That's the priority.
And then to balance that out, I think that's a wonderful presentation, especially when we look at, and we've kind of produced literature at Arihanta also on diet and the notion of jivas and how many jivas in certain kinds of embodiments, whether these are two sensed above and so on. From a purely medical perspective, would you speak similarly or different if somebody was talking to you about root vegetables, but say is not as, hey, I would say dialed in to Jain ethics at a certain
So
point?
I do not ask them to stop it. I'm like, first of all, give up animal products, give up dairy, because if they're consuming animal products, I'm like, what's the point of talking about this? That, oh, you're doing this. First of all, you got to give up all the processed foods, give up mahavigais, give up vigais, and I mainly talk about that. If they are Jains, then when they ask, I know that onions and garlic come in tamasic food category. That will kind of, again, increase your sensual pleasure. So when we are at that level, we're talking about spiritual health, all of that. Then I give that. That's the recommendation. I personally follow it that way, but I don't impose that on anybody. I just provide all the resources and let them make their choices. But I definitely strictly ask them, if you really want to get better, first thing you need to give up is all sorts of animal products and processed foods.
So just to add on to that, I'm scrolling down and I see a question that's similar, and so we can kind of wrap that up. As a question here says that as Jains, we don't eat potatoes, onions, and other root vegetables. So how can we have a diverse vegan diet while excluding these items? And I'm assuming that's in addition to meat, and then now all dairy products, eggs, honey, and so on.
Oh, you'll be surprised. There are so many items out there. I mean, you can look at me. I've been doing this for more than 10 years and I've only advanced. I mean, I when I am with my batchmates, the same doctors we trained 20 years ago, people cannot recognize that we were together. They think I'm their fellow, I'm their trainee. So just being on this diet is going to help you. And there's plenty of resources out there. You would be amazed. There's alternatives for everything. And in today's day and age, we're so blessed with everything. I mean, food, all kinds of vegetables and foods you can get. Even when I'm in America, I can get all kinds of fruits and vegetables that are grown in India. So because of the transportation, you get everything wherever you want. So once you start looking into it, you will realize there are millions of recipes out there, lots of variety of vegetables. The goal, by the way, for healthy, there is some data on this. If you really want to be healthy, you should consume about 30 to 35 different types of fruits, veggies, beans, nuts, seeds, whole grains. So all the things put together, even including spices, if you have 30 to 35 different types per week, which has various different colors, you're really going to get all the phytonutrients to become stronger. So what your body really needs is easily out there. There are like 70 different types of beans out there. There are multiple different types of whole grains out there, plenty of vegetables, plenty of fruits, seeds, nuts. You go through it and you'll notice that you will have everything you need in Jain whole foods vegan diet if you really want to follow that. But definitely give up all the animal products and processed foods.
Next question is, and I think we've talked about, we've kind of touched on little aspects of this, but I think this is a general question that's being asked, which is, where do you see the greatest tensions between ancient spiritual practices and contemporary medicine, or kind of mass population healthcare? So I don't know if you want to ask this kind of in the abstract or conceptual sense, or even personally, where have you seen the kind of greatest tensions and then maybe the greatest possibilities for improvement?
I think it's lack of awareness on both the sides. There are people who are promoting vegan diet and there are people who are promoting dairy diet. I think if both the sides are willing to learn a little more about each other's perspective, things are going to be much different. Because many times I see strong proponents of vegan diet have not much idea about Jain concepts. And on the other side, strong proponent of dairy-rich Jain diet, they're not really, they have not really looked into current practices or the health aspect of it, or really deep dive into the medical literature part. So those are the parents. But what I've noticed is, if I talk about the violence in medicine, majority of the medicines right now, be it over the counter or prescribed, are filled with violence of five sensed beings. There's meat in majority of that, unless you call multiple different brands, and then eventually you find a brand which does not have any animal product. So the point being, if you're consuming a meat, a medicine that is rich in meat, that has meat in it, and you're calling that, I'm still going to consume dairy products because everybody, it was mentioned in literature without addressing the fact that, well, it is causing me the sickness and illness for which I have to go and consume the medicine that is rich in meat, and also all the get the medical tests which are all performed on animals first, so full of violence, just so that I can continue to consume vigay. Then that's where the big problem lies. Once we recognize that, once we're able to explain it in a very nice, gentle, neutral way to those who are not willing to understand, it will eventually stick. But sometimes we are so passionate about the cost that we forget the part of this, the history behind their habits. And so we have to make sure that we do not hurt anybody's ego. The moment we hurt anybody's ego, the conversation, the objective part of the conversation disappears, and it's all emotions driving the conversation. And that's where the tension occurs. So just being gentle, being neutral, being compassionate towards fellow being, and understanding the lack of awareness and trying to help them where they are to reach the next level helps. You're muted. You're muted.
Sorry. I said a teacher once said to me, it's not what you know, it's what they learn. So, whatever you know becomes irrelevant. If you're in a teaching setting, your knowledge is irrelevant. The only thing that's relevant is what gets absorbed.
Great point.
So I'm trying to put things kind of in different contexts. I guess let me stay on this for a moment. So if someone's asking, because you said a moment ago about the kind of diversity of things you can eat, even if you're not eating all of these things. And I think maybe some individuals know that, but there's a question here: how many fruits, vegetables, like per day would meet your recommendations? But I guess maybe a general question, if you want to, I don't want to put you on the spot, like kind of like walk us through maybe like what a day might look like. And I think this leads into another question. There's been a couple questions about why we shouldn't eat too late in the day. So I don't know, maybe if you want to talk about like what could be just kind of a basic day, and then when that would end in terms of consumption.
Sure. So first question was about fruits. I'll recommend an app called Daily Dozen by Dr. Michael Greger. It's freely available, Daily Dozen. And the beauty of it is it has 12 different categories that you should consume or practice every day. And it tells you number of servings of each. And in each category, there are different food options that it kind of lists for you. And there's a nice YouTube video on how to use that app. There's a nice tutorial on how to use that app. You can keep track of things, or you can take a printout. You can go on Google and type Daily Dozen, and there will be PDFs. You can take a printout and put it on your refrigerator, and make sure you're making sure you cut each, consuming from each food category, so you get all the nutrients. What my personal days look like, I generally skip breakfast, but if I do breakfast, then I'll have rolled oats or steel cut oats steamed real nice with lots of berries, bananas, then maybe some dates, put some chia seeds in there, put cinnamon powder in there. That's a very nice, wholesome breakfast that I love. And my wife is an amazing cook, so she has all kinds of these Jain vegan recipes. So she Kinjal is her name, and she helped me with the presentation as well. That would be my breakfast. Not the Indian breakfast like khakras and all of that. That's pretty not good for you. So you want to have, if you can't do that, just have fruits in the morning. You can have bananas. You can so those kind of things. Generally, my goal is in a day's time, I'll have at least 5 to 6 fruits. And I'll have a handful of nuts, no more than that. And these nuts are raw, not oily, not salted. So, and almonds, walnuts, cashews, raisins. Those are the things you can have, or pistachios. No more than a handful because they're pretty rich in fat, but they're rich in nutrients too. And then when you can have all kinds of meals. So you can have traditional Indian meal where you do roti without oil or ghee. You can have vegetable curry without oil, lots of vegetables. You can have beans, and then you can have brown rice. So dal bhat rotli shak is what we say, but you just have to make sure dal is actually bean and not dal. So you take the bean, and then the rice should not be white rice but brown rice. So you don't polish the fiber out of the brown
Mm.
rice to make it white. You actually consume that brown rice. And you can make the roti out of different kinds of grains. So that's traditional Indian diet. Or you can have red lentil pasta or edamame pasta. These are just one grain products. So there are multiple different options out there. There are lots of barley options out there. Simple, you don't have time? Well, have beans and brown rice. Or you can have Buddha bowl with lots of, there's
Mm.
quinoa in there. There are all sorts of vegetables in there. Then there are beans in there. So there are multiple different options. Any kinds of cuisine, be it Mexican, be it Burmese, be it Italian, be it European, you can make any kind of cuisine that you want, and you can make it whole foods plant-based diet, and you can make it even Jain. So plenty of options. Now the last question was, why should you not eat late in the night? Well, as a GI doctor, I can purely tell you, just from GI perspective also, that whenever whoever eats later in the night will have all sorts of GI illnesses. They will have heartburn, acidity that they call in India. You can have bloating. The food does not get digested. All those things occur when you eat late in the night. The other thing is, whenever you eat late in the night, hardly ever you will eat anything healthy. You will always go on and go for calorie-rich, unhealthy diet. Other thing, the same food that you eat in the day, if you consume the same food at night, it is more likely to help you gain more weight. Actually, you end up not help you, hurt you, by putting on more weight because the metabolism rate is different at night compared to daytime. So there are multiple different reasons why you should not eat. And from Jainism standpoint, they say Ratri Bhojan is Narakanu Pehlu Dwar, means that's the way to go to hell if you eat late in the night. So from whichever perspective you start talking about, you end up with the same answer. Do not eat after sunset. Ayurveda also recommends do not eat after sunset. Actually, they ask you to stop eating 1 hour before sunset
Oh.
because your sun is aligned with your digestion. Another simple example I'll tell you, alligator. I went to Florida a few months ago. And that's when I learned that alligators, when they eat, they actually come up to the top of the river or ocean so that they get the direct sunlight. If they don't get direct sunlight, they can't digest and they'll end up sick, falling sick, and really become ill. So sunlight helps you with your natural digestion. So definitely sunlight exposure is very, very important. But the point is, your eat food, you should consume food when the sun's out. I mean, it's in the daytime. That's what I mean. Yeah.
Oh, fascinating. Just a little pivot here. A question from Renan LaRue, who will be giving our next presentation, is here today, professor at the University of California, Santa Barbara, and says thank you for an amazing presentation. And I have a few questions. And the first one is what is the evidence of the negative relationship between, say, meat or animal foods and processed foods and meditation? What does, say, Jainism have to say about that? Or as a medical doctor, what you would say about
So
that?
Jainism talks about Mahavigya and Vigya that I talked about, how it changes your, when you have, so the whole part of spiritual health, mental health is making sure meditation is that you should not be, your sensual pleasures should not be triggered. You should not be distracted outside. You want to look inward, and food will trigger that. That's from the Jainism standpoint. From medical standpoint, there is a lot of data. Now, I don't have the citations to tell you, but there's a concept of psychbiotics. Psychbiotics, that means you have these good bacteria in your gut that helps you maintain your brain health. There are millions of nerve fibers that connect your gut to your brain. So everything you think of affects your gut. Everything you consume affects your brain. I mean, just think of it. Alcohol you consume, it's a chemical that gets absorbed and triggers and affects your brain function, causes disinhibition, maybe drowsy, somebody gets excited, all kinds of things happen. Well, it's an alcohol, right? It's alcohol. So we're like, how can you compare that with food? Every food or alcohol is a chemical. and every chemical has its impact. So it's very well known that when you consume whole foods, plant-based diet, people feel more fresh, less lethargic, more energetic, their depression improves. And I have had examples where just purely on whole foods, plant-based diet, sunlight, exercise, I was able to control their psychiatry symptoms.
Mm.
Now, there are plenty of data, and actually we were just talking about that, creating a presentation for that. So soon we're going to do a workshop at our Houston temple on mental health and diet, and hopefully by then I'll have a presentation for you all where we'll connect or gather all the data and show it. But absolutely, it is very powerful. And
That's fascinating. A related question that Renan asked, I'm just going to jump over the middle one because these are connected, is, and it's not really kind of say medical specific, but you said earlier on that stress is located or at least affects the consciousness, not the brain. So maybe for folks in attendance who are not as familiar with the Jain kind of notion of the consciousness versus the brain, you can give a little bit more details about that.
so when I say not the brain, it's not the brain is affected, of course, and you're going to see that. But the question comes, what comes first? Is it the conscience or is it the brain? And we have a few videos dedicated to this concept. Just think about it. There are about 2,500 examples, 2,500 case studies at University of Virginia in, in Department of Perceptual Studies, where Dr. Tucker has been working on, and Dr. Stevenson before, where kids from age 4 to 6 were able to remember their past lives. And there are videos published on it. There is data published in our medical literature on this. They actually went to those places, verified everything, checked out all the possible alternatives, what it could be, and they eventually realized there was something else. There was an entity that traveled from that life to this life. So what it means is, if it was the brain which had all the memories and emotions, the brain from past life was either buried or burned. That's not the brain that this person has at this time.
Mm.
But still, they're able to remember those memories and have those emotions associated with those experiences. If it was related to the brain, this brain that was formed is from this life that you got from your mother, from the food that you consumed. And every 5 years, every particle in your brain has changed, because our body is constantly getting rid of dead cells and forming new cells. So if it was the brain, 5 years ago, whatever the memories were, they should have been gone because it's completely replaced by a new brain right now.
Mm-hmm.
But that's not the case. The memories, the emotions stay. So that proves that there is something else outside of this physical body that we see that's actually carrying all the memories and emotions. And definitely check out Dr. Tucker from University of Virginia. Check out Stress Academy. I think video number 9 or 10, we have elaborated that a little bit more. And there's a concept of something called as past life regression therapy. Dr.
Mm.
Brian Weiss from New York, in his, he used to do hypnotherapy. He was a psychiatrist, and he noticed so many patients talk about their past lives. And he wrote a book called Many Masters, Many Lives, worth reading. But then that led to this past life regression therapy. Some people have some kinds of phobia or some kind of unexplained pain. So they hypnotize these patients, get them to their past life, and actually eventually they find a life where they had such experience, traumatic experience, that causes similar pain in this life. They reconcile that memory and they wake up pain free, phobia free, disease free, and that happens. Not everybody's successful, but there's a lot of data on past life regression therapy. Dr. Brian Weiss and Dr. Tucker at University of Virginia, and of course, Stress Academy has some videos too.
Wonderful. I've been dropping a few of these into the chat. I'll continue to do so
Thank you.
in these
Thank
last final questions. We have a little bit of time left. I'm going to pivot. I mean, we're kind of still in this orbit of diet and stress management. So there's a question here specifically about stress, and says, stress is a major factor in both chronic disease development and its management, and Jain philosophy advocates overcoming stress through austerity. So this is tapas, or tapas, referred to in Professor Mutha's talk. How does your work at Stress Academy integrate the principle of lifestyle medicine and Jainism to address the psychosomatic aspects of disease? Could stress mitigation itself be considered a form of modern day tapas?
Absolutely. And as I talked about, so I talked about 12 tapas, right? So internal tapas, there are 6 internal taps, right? Internal
Mm.
taps. which is Vyavach, that is Vinay, humility. There is Prayashchit. There is Swadhyay, meditation. There is Dhyan, that is again different type of meditation. There's Kayasar. So there are 6 different types of internal, and when you do one samayik, so Jainism recommends doing 48 minutes of sitting at one place and meditating. That we call it samayik. When you do that, you're really meditating on your. Now, a lot of Jain students, when they start their journey of Jainism, they sit at one place and they'll read a book or they'll chant mantras or they'll listen to something, which is kind of okay. But your true goal is to really look within for those 48 minutes. And that's true meaning of samayik, when you're in equanimity for 48 minutes. And that helps you address stress and really retrospect and reflect on all the things that you have read and learned in Jainism and apply to your real life. Repent for all the bad deeds that you may have done and correct them. Ask for forgiveness through your mind, body, and soul. So there are lots of different things that are part of a Jain's practice on a daily basis that's going to help you, reverse this stress, resolve this stress. Remember, all these 6 pillars of lifestyle medicine are like domino effect. You mess up one and you end up messing up everything. So you start, let's say you fix your diet, you're going to have more energy to exercise. You're going to feel much better to actually do stress management. So everything is going to help you when you start the journey by fixing one thing. But if you mess up with one, it's going to impact all the other. If you don't sleep well, you mess up your sleep habits, watch movies till late, go out and hang out and party and eat late. That's going to mess up your sleep, and that's going to not let you be calm, be in state of equanimity. More likely, you're going to be vulnerable. You're going to get triggered very easily. You're going to get angry. So your stress is going to get exaggerated. So all of these things are so interlinked. I don't know if I answered the question. I thought I covered multiple aspects, but if there's still more question, I'm happy to answer on that part.
Yeah. Okay. I think that's a complicated kind of issue for sure. This notion of stress and kind of management, tapas, austerity, fasting. And a lot of these ideas are not as encultured into non-Jain or Western like notions. When the notions of fasting takes on something completely different, it's not really in this sense of a kind of development or psychological development, spiritual development. There's a couple of questions here, and then I would like to ask maybe some general question to wrap us up. But I think there's a question here a little bit about Ayurveda and dairy and Indian beliefs in the health benefits of ghee. So I guess in general, how would you attribute, we talked a little bit before about the presence of dairy in Indian culture, but there is also, right, thousands of years in Ayurveda, in early Ayurvedic texts about the health benefits of dairy. So could we speak to that? Is it just that this was misinformed, less informed, or during a time of, say, non-abundance that we could have now in certain contexts? I'd be curious what you think about that.
Yeah, all those points that you mentioned. And Ayurveda is, we tend to think of Western medicine as one thing. So Ayurveda is one thing too. That's not true. Ayurveda has multiple different versions. Ayurveda just simply means medicine. And there were different types of Ayurvedic books back in the day. But now coming back to ghee, that is a very well-known example. Ghee ghee is really fat, 100% fat. What it was used for truly was as a vehicle to give the medicine to the patient. Fat soluble medicines were given through this medium of ghee. And the consumption, now Rajasthan, I'm originally from Rajasthan, my ancestors from Rajasthan. So people are like, oh, Rajasthanis eat so much ghee. Well, back in the day, there was not much rainfall. It is a desert still, and not many plants, and the survival was at stake, and still they loved, and there was a lot of hard work being done, and the production of milk was also very limited. So the consumption was also very limited. So you have to put everything in context. But on top of that, there were no slaughterhouses to kill the newborn calf back in the day. So you have to put all of those things together. Those cows were happy. They were taken care of. Their babies were taken care of. Everything was well fed. And if you had a little bit of extra, that was used as medicine, not as dairy consumption for day-to-day routine in the abundance that we do today. Like you mentioned, it's insane amount of dairy that I'm shocked that, whenever I go to a restaurant, many times Indian restaurant, hardly any food product that I find which does not have dairy in it. Sometimes I
Hmm.
have to go to a non-Indian restaurant to find a Jain vegan food item for me to consume when I'm out of town. So it has been ingrained, it has been overdone. Every part of the food that has it has dairy in it now, and the dairy that we get right now is extremely unhealthy. So it's just bad at multiple levels.
Great. And I think that's a good point where we can kind of zoom out as we wrap up here, even to other themes in this Voices in Vegan Studies speaker series, right? You're a medical doctor, a Jane. We've had philosophers, policy experts, legal scholars, and we'll have additional people towards the end of the year. But I think what you're also speaking to is what I was reading recently is known as this kind of ratchet effect when it comes to food production, where that we've gotten to a point of industrial food production and a number of people on this planet where there also is no going back, right? There's no going back. So even if we kind of invoke these times in which animals live different lives, and we could have very detailed philosophical debates about how ethical that was or how necessary that was. But right, it really becomes a moot point because we've reached a level of global population and industrialization and globalized food systems where there's no potential to go back, and actually we would lose benefits in doing so, such as efficiency or increases in medicine and nutritional information that will help us provide better food to larger numbers of people. So it does make me think about that a lot of the questions when we're talking about Ayurveda and ghee, or other ways in which people farmed animals, it really becomes more of an intellectual exercise than anything else.
Absolutely. Great
Yeah,
points. Absolutely. I
great.
agree with all of those points.
Well, that's good. I think this is a huge, and as I'm going to wrap up here, this is a huge aspect of what I refer to sometimes as this vegan horizon in all of our speakers, is that we're having a number of experts and thinkers, um, and advocates talking about different things, but I think coming at different angles, realizing that kind of the end goal, the end trajectory is the same. Similar to what you said earlier about there's so many ways we can get to why you shouldn't eat late at night, right? Whichever angle you want to come from,
Absolutely.
we're going to pretty much get to the
Same.
then point. And listening to you today, and seeing how it's not that you've abandoned the past, kind of the Jane past, but actually no, it's very dynamic in the present, but it's just incorporating what you've learned as a medical doctor, and also seemingly about your own tradition and how it integrates with that practice. So is there anything else you'd like to say to close us out today?
So definitely start with becoming healthy, and that will help you upwards in all your aspects, be it professional life, social life, spiritual life, or personal life. And to start your journey to be healthy is to start eating right, because you are truly what you eat. And that will only happen if you stick to whole foods, plant-based diet. And it's not like you're torturing yourself. There will be first 3 weeks will be rough, but then it will be liberating journey for you, and you will never want to go back to how you felt before. So this is actually not trapping you, but actually releasing you from the shackles of addictions of food. Food addiction is the most common addiction that we haven't recognized,
Mm.
and that's what's ruining our health. So if you start doing that, you're going to be good on every aspect of life.
Wonderful. Thank you once again, Dr. Mutha, for taking time out of your very busy schedule to join us, but also to give this information that I know is critical for our
Yeah,
community and numerous communities. Just to let you all know, this recording will be available. The recording of this talk will be available publicly. So I think many people will be able to watch it again and also share it with those who they care about and want to see improvements in their lives. So thanks again. I hope to see the rest of you at our next talk in a month's time with Dr. Renan LaRue from the University of California, Santa Barbara, and then 2 more talks to close out 2024. So thank
thank
you
you.
all,
Thank you,
and
Mike. Thank you.
see you next time.